Nearly 2 weeks into school, and Clark County deputies and families are still dealing with some challenges. News 3's Tiffany Lane has an update from Superintendent Jara on contact tracing, safety protocols, and other issues impacting students and staff.
CCSD students are about to wrap up their second week of school. We talked to Superintendent Jara about a few issues concerning families. While hosting the Lieutenant Governor of New Mexico Thursday to share the district's approach to reading literacy, Dr. Jara stopped to provide answers on some issues concerning district families. We asked about contact tracing, referencing Frank Lamping Elementary. Just days ago, the principal sent a message to parents that the entire school would go to distance education through August 27th because of COVID cases. How does the district decide when there will be an individual COVID quarantine? What about an entire school?
We're working with the state in collaboration with the Southern Nevada Health District as well, and our nurses who are doing an amazing job and really getting through the process, and then we'll notify the people. As far as closure of a school, that is a decision that is made collectively with the school district, of course. The recommendation from the Southern Nevada Health District to make sure that our children are safe. And the length amount of time, that is something that, again, that we coordinate together.
As far as quarantine so early in the school year,
cases and positivity is going down. In Clark County. Our priority is to keep our schools open, and we're going to do that. We are committed, the school board, myself, all our partners are committed. The best way to keep our schools open, is keep your mask on and get the vaccine.
Some parents reached out to me worried about how their kids will learn while quarantined. Here's what Jara had to say.
So when you're in quarantine, it's actually, I was just talking to the principal right here. I mean, they got tripods for every school. So kids who, at Legacy High School, once they're notified in their quarantine, they go home, distance education. They purchase tripods, and then the teacher's doing a lesson for the individual students, not for the class, but then the kids are at home.
Superintendent Jara also addressed concerns staff have about safety protocols, including social distancing, something that has become more difficult with staffing shortages, including 700 teacher vacancies.
We're having, conversations with our building leaders. The implementation guide, actually, we're working collectively and collaboratively with our county officials, the Southern Nevada Health District. The teacher shortage is an issue, and we're doing a great job, and just our principals are doing a great job in making sure that we follow protocols that we have outlined.
CCSD families and staff, how have the first 2 weeks gone for you? Let me know. School tips at news3lv.com or call 702-805-0489. And tomorrow on News 3, an update on the Nevada Learning Academy, some of the challenges those families are facing, and what the district is doing to help.
CS gas, 2 active live scenes, and bullets being shot in their direction by a suspect who said that they were intent on killing them. That's the reality that Nye County deputies experienced during this very high pressure afternoon, shocking locals who call this a peaceful and quiet town.
Investigators say it began at a home off Leslie and Mesquite with reports of shots fired into a residence.
That residence is the girlfriend of our suspect. We've had an ongoing dispute for the last week with him, and not just her, several people in the community.
Neighbor Pamela locked her door in fear.
I heard a regular, I guess they were pistol shots, and then these big boom, boom, like a percussion. And so I said, we were sitting out on the porch. I said, let's go on in the house because bullets travel.
The sheriff's office says no one at the home was hurt. They then tried to locate the suspect and found him in his home. That's when deputies say the situation turned volatile.
The suspect fired numerous rounds at our deputies.
Nye County posted this picture to its Twitter page. Deputies crouching behind patrol cars, dodging the bullets.
He was adamant that he was going to kill us during this encounter.
A SWAT team came and started negotiating.
And, we used less lethal munitions to try to get him out of the residence. And then ultimately we made entry into the residence and located him with a gunshot wound. We believe that to be self-inflicted, although at this time that's under investigation.
The suspect taken to the hospital. His condition unknown at this time. As for Pamela,
it was worrisome.
She's still rattled from the unnerving scene just steps away from her home.
It's pretty worrisome, because who knows how many other situations will come up like that,
Thankfully, no deputies were hurt aside from some being exposed to that chemical gas.
State health officials continue to express cautious optimism at indicators that Nevada might be near the peak of this latest COVID wave.
As of Monday, August 16th, Nevada has the lowest 14-day change in cases nationwide due to its proactive mask guidance and vaccination effort.
Dr. Ellie Graydon with the Nevada Health Response says case numbers in Nevada are starting to flatten out, and so are hospitalizations.
Statewide, hospitalizations also continue to increase, but at a slowing pace. The rate of hospitalization increased by 3% over the past 2 weeks, August 1st through the 15th. And this was a significant reduction from the previous 2-week period.
And Nevada's test positivity rate.
We're still watching our positivity rate, even though we are so thrilled with watching it go lower, but it's still high. And so we're still in that place where we need to promote vaccination.
Candace McDaniel also says more than 92,000 Nevadans over the age of 12, 3% of the population, are now eligible for a third dose of the Pfizer or a Moderna vaccine after a go-ahead from the FDA.
The recommendation includes people with a range of conditions, such as recipients of organ or stem cell transplants, people with advanced or untreated HIV infection, active recipients of treatment for cancer, and then people who are taking some medications that weaken the immune system.
Nevada Health Response also says it's rolling out the new Pharmacy Depot program to make it easier for Nevadans to get a COVID shot from their own doctor, who can now order small amounts of the vaccine from pharmacies.
This pilot program is designed to support patient access and increase the number of Nevada healthcare professionals able to stock and administer COVID-19 vaccine.
It's still uncertain if the State Board of Health will recommend vaccine mandates for students in the Nevada system of higher education. We should know more about that after the board's emergency meeting at 9 o'clock tomorrow morning.
Hi everybody, I'm Reed Cowan from News 3 Las Vegas. We want to thank you for checking out our YouTube channel. Remember, you can always see more of our videos by clicking on the video links. And also don't forget to click that subscribe button so that you don't miss out on any of our YouTube updates. Thanks for watching.